Hello and welcome. Today we're diving deep into a rare but fascinating condition called Liddle syndrome. This is a genetic disorder that affects the kidneys and blood pressure. We'll explore what causes it, how it impacts the body, and what can be done to manage it. So what exactly causes Liddle syndrome? The culprit lies in our genes, specifically mutations in genes that code for subunits of the epithelial sodium channel or ENaC, primarily SCN1A, SCNN1, and SCN1G. These genes are responsible for telling the body how to make and regulate the ENaC in the kidneys. When these genes mutate, it leads to an overactive ENaF, causing the kidneys to retain too much sodium. Now let's understand the pathophysiology. The ENaF is located in the principal cells of the collecting tubules in the kidneys. Its main job is to reabsorb sodium from the urine back into the bloodstream. In Liddle syndrome, the mutated ENaC is constantly on, reabsorbing excessive amounts of sodium. This excess sodium pulls water along with it, increasing blood volume. The increased blood volume leads to hypertension, or high blood pressure, and can suppress the renin-angiotensin-aldosterone system, a crucial hormone system that regulates blood pressure and electrolyte balance. The suppressed aldosterone levels ultimately contribute to hypokalemia, or low potassium levels. Liddle syndrome is a very rare disorder. Due to its genetic nature, it's present from birth, but symptoms may not be apparent until later in childhood or early adulthood. Because it's rare, precise numbers on its prevalence are difficult to obtain. However, it's important to remember that anyone can potentially be affected if they inherit the mutated genes. The signs and symptoms of Liddle syndrome can vary from person to person. The most common symptom is hypertension, often severe, and presenting at an unusually young age. Hypokalemia or low potassium can also be present, leading to muscle weakness, fatigue, and even cardiac arrhythmias in severe cases. Because of the sodium and water retention, individuals may experience fluid overload, leading to swelling, particularly in the ankles and feet. Diagnosing Liddle syndrome can be challenging, as its symptoms overlap with other conditions causing hypertension and hypokalemia. It often requires a high degree of suspicion, especially in young individuals with unexplained high blood pressure. Key diagnostic tools include blood tests to measure potassium, sodium, renin, and aldosterone levels. Typically, we see high sodium, low potassium, suppressed renin, and low aldosterone. Genetic testing is crucial for confirming the diagnosis by identifying the specific mutation in one of the ENaC subunit genes. Liddle syndrome isn't typically classified into different subtypes. The condition's severity can vary depending on the specific mutation and individual factors, but the underlying mechanism, the overactive ENaC, remains the same across all affected individuals. Unfortunately, there's no cure for Liddle syndrome, so treatment focuses on managing the symptoms and preventing complications. The cornerstone of treatment is dietary sodium restriction. Medications called potassium-sparing diuretics, specifically amiloride and triamterene, are highly effective. These drugs directly block the ENaC, preventing the excessive sodium reabsorption. Regular monitoring of blood pressure and potassium levels is also vital to ensure treatment effectiveness and prevent any side effects. As Liddle syndrome is a genetic disorder, there are no specific preventive measures that can completely eliminate the risk. However, genetic counseling can be extremely valuable for families with a history of the condition who are planning to have children. Genetic testing can help determine if individuals are carriers of the mutated genes, allowing them to make informed decisions about their reproductive options. The prognosis for individuals with Liddle syndrome is generally good with early diagnosis and appropriate management. With consistent dietary modifications and medication, blood pressure can be effectively controlled, and the risk of long-term complications, such as heart disease and kidney damage, can be minimized. Research continues to explore the intricacies of the ENaC and potential new therapeutic targets for managing sodium balance in various conditions, including Liddle syndrome. While specific breakthroughs for Liddle syndrome are rare, advancements in understanding the ENaC have the potential to offer more targeted treatments in the future.